Hello, everyone. I am Denise Sweener. I am the Executive Director of Buffalo County Community Partners, and we are so thankful to have all of you joining us today. It looks like we have 73 that we just brought into the Zoom meeting. If you would start off by posting in the chat your name and title or organization.
I can't hear.
Oh, let's see if we can fix Carol.
Can you hear me?
I can hear you.
I can't hear. So let's see. Oh, maybe.
Does that help, Carol? Can you hear me now?
That helps a lot. Oh, the magic of technology.
All right, we got Carol going. So yes, if you put your name, your title, the organization that you work with, if you're with an organization, feel free to talk a little bit or, share a little blip about the work that you do. We'd love to get to know all of you that are on this call. So right now we're at 76. I think we have almost everybody in the room. So I think we can go ahead and get started. Matt Morris, our data coordinator in the office, is behind the scenes doing the PowerPoint. So if you want to start with the first slide, Matt, we will get started.
Good afternoon. My name is Nadia Sadi, and I am the current chairman of Buffalo County Community Partners. And thank you all so much for joining us today. This is so exciting to see so many people here. I wish we were actually seeing people here, but I see the number on the bottom of my screen. So thank you to those of you who have started this process with us earlier this year. And those who are back at this table continuing the work. I think we can agree Kearney is a community of very passionate people. And I heard someone say recently, yes.
Can I hold you just for one moment? I'm going to mute everyone because I think we're getting a little bit of feedback, and then we'll have you unmute to get started.
Sure.
Matt, can you mute all of us and then unmute Nadia?
All right. So I have permission to go now, right? Okay. So anyway, I am confident that we are in the company of amazing people to help move this work forward. We are on a journey towards a vision for 2030. We would like to present this work to you, our community partners. Buffalo County Community Partners is willing to serve as a backbone of this work. And through the course of this past year, we have heard from amazing partners in all sectors: public, private, nonprofit, people with ideas and aspirations to work together and be change agents for our community. Although we would all hope for one magic intervention that would have measurable effect, we recognize the complexity of life and many events that interact to influence and reinforce. By looking at the needs and challenges in our community and formulating a collective approach, we hope to have a greater impact. This work has and will be based on historical data. And what we hope to achieve by gathering today is to learn what is missing or what is something that we have not yet heard. We also hope to garner your support to move forward in bringing more community partners into this conversation. We look to those of you in attendance today to guide this work, as you have already shown a vested interest in moving a community vision forward by attending. So I would like to introduce our fearless leader, Travis Gregg, if he would like to take it from here.
Well, thanks, Nadia. Yes. So for those of you that I don't know, my name is Travis Gregg, and I serve as the Chief Operating Officer at Kearney Regional Medical Center. But Denise had asked me, probably a couple of years ago, to get involved in the work that was being done around the 2030 vision, and was part of a planning committee with some folks that are actually on this call today, and started to take a look at some data and be able to turn that into information. And if you'll go to the next slide, please. One of the tools that we're going to use in order to help achieve this vision together is this collective impact model. And really it's kind of a spectrum. There are different areas and programs in our community that may be in different stages within this model. But to take a look at it, so from the beginning, you've got isolated impact. So what does that mean? Can you still have impact? Well, of course. So you may have individual agencies or certain folks who feel very strongly about a cause or a potential impact or something that is a gap area within our community, and they may work to provide services to fill that gap. But maybe they're not part of a larger group of folks that are working towards a common mission or towards a common collaboration in those areas. And sometimes what we see within our community is, gosh, it's a great thing to have because we have so many people that are engaged and involved to make this community a better place for all of us. But we see duplication of efforts at times. And so that's kind of where you're at and what you see with the isolated impact. The next stage within that journey is working on collaboration and partnerships. So you have some common goals, you've got a common topic, you have some of the same folks that are sitting there being able to be at the table. They're kind of the strong voices, the ones that are always sitting there being able to help out, but maybe they still kind of lack a bigger picture and they're not fully developed in their idea yet. It's a group of individuals that are coming together for a partnership, but it hasn't really reached that collective. So when you get to that collective impact, then that's where you have all of the same shared goals, the same visions, you have alignment there. So you may have people working from different agencies who, or people who are approaching the problem or the issue or the environmental factor from a different perspective, but together they're all working towards a common goal and to reach that vision. And that's really what we're looking at doing in the tool that we want to use for 2030. It's not to tell anyone on this call that what you're doing needs to stop. You need to cease and desist, and that Denise and Buffalo County Community Partners, they're coming in to take over. That's not the case at all. In fact, it's the exact opposite. We want to have as many people at the table as possible. And I see we've got 90 participants today. So how great it is to have so many people here included so we can have this work towards these common goals and this collective impact. And I'll just give you just kind of an example of this, kind of something close to my work. We took a look at a while ago of trying to solve an issue for us, which related to a workforce issue. And one of the things that was affecting our workforce was access to childcare. So from an isolated impact, we thought, hey, we've identified this need. What can we do to take a look at it? So we started running some pro formas and taking a look at, is there something that our organization could do to put together a daycare and be able to solve this issue for us around retention and workforce? And what we learned is that us individually, we didn't really have the resources and we weren't set up to operate that type of a business and to have that type of an impact. So from an isolated standpoint, it didn't make any sense for us. So we've started now to take a look at, are there people that we could partner with or could we collaborate with? Or if we were to fully move towards a collective impact model, and if we had more information, would we make decisions differently? Would we take a look at how together we could affect overall childcare development within the community, understanding bigger access issues? So for us, I think, although we had this isolated view of it from the beginning, if we were to take a look truly from a collective impact model, we could have a lot more overall impact, not only for our organization, but for the community as well too. I will turn things over then, and I believe Joanna may have some comments for us.
Hello, everyone. Great to be with all of you. Can you hear me all right? A thumbs up, Denise. I can see you. Great. Okay, team. Well, just as Travis was saying, when you look at that collective impact, that final column there, a couple of things I want to point out for you is that it talks about that all of the relevant actors, or so all of the agencies or individuals or organizations in the community that are working towards these goals that we'll be talking about today, that they are starting to measure success collectively towards those goals. And all of you who are coming from agencies or individual organizations know that year after year, you collect data. Many of you submit data to your funders, you submit data to your constituents. And what this model is inviting us to think about is how would we pool our collective knowledge and information, our shared understanding as a community, and begin to coordinate our actions based on the lessons that we share with one another about the work that we're doing. And so collective impact model asks us to align our work as best we can against some common set of measurement or some common goals and a common way of looking at things. As Buffalo County Community Partners thinks about its work, it has chosen to frame its evaluation in a model called results-based accountability. And let me show you that next slide. Thank you. So the RBA model is a very simple way of really getting a lot of data across a community to align. And if you think about your work individually in organizations, oftentimes you are looking at both your organization's data and you're looking at against the larger population or the larger regional or community data. And as a group, we were talking about this last week, that if we were to just look at some major data points for, say, children in the Buffalo County area, we might look at the number of children, 19% right now, who are living below poverty level, or the number of children who are experiencing their out of home care, meaning that they've been removed from their home, or there've been neglect reports on children, or we might look collectively at the total population data around teen pregnancy or infant mortality. We would look at the large scale data in a collective impact model together. And then we would come back and look at our individual efforts and be asking, how is the work that we're doing, how do we measure the impact of our work against this larger shift that we're hoping to address in the community? So the RBA model invites individual organizations to think about how much did they do, and we're very good at this in our organizational data. We count the number of people served, we count the number of activities provided, or the number of programs that we've developed. People have been served. The second question, though, that RBA asks is, how well did we do it? So did we improve our services? Whereas the quality of our work, something that we could begin to measure? And then the simple third question is just, is anybody better off? And so this conversation about how much did we do, how well did we do it, and is anybody better off, happens first at an organizational level. But then we marry that up with population level data. And over time, we're asking ourselves, are we seeing a decrease or an increase in the specific measures that we're looking to? So if we were to look at number of teen births, if we had a group of family or organizations together that were looking at reproductive health or education for teens around pregnancy prevention and healthcare, could those individual agencies report back out on how much that they're doing in that area? How well did they do it? And are they actually seeing a decline in one of those measurements that's important to them, or an increase? So an increase in access, for example, to healthcare services, and maybe therefore a decrease in teen pregnancies. Or if you think about food and nutrition, if you're seeing the number of families who are reporting that they do not have food security, so they don't know if they have answers about where their next meals are coming for. We can test at the number of people who have been at an individual agency for services, and over time we could look collectively as a community about whether there's a decrease in that insecurity around food access. So this model is pretty simple. How much did we do? How well did we do it? And is anyone better off? But it moves us from individual level data to population level data, and back and forward across that continuum as a group of organizations and leaders think about shared measurement and shared evaluation. So this is something that we'll come back to and talk more about as we share more of the presentation with you. But we wanted you to be realizing that as we think about this vision that we have for the future, one of the things we have to agree upon is how would we measure our success towards that vision? And we believe this simple RBA model can be one of the tools that we would use in the future as a variety of organizations coming together to share information. Thoughts about that or questions? Okay, we'll move towards the next slide.
All right, so the board has put into play a goal to help us move forward. And that goal is to advance innovative solutions to complex social issues. And these are complex social issues that we have heard, bits and pieces of so far in this conversation: childcare, food security. But innovative solutions begin with some of the pieces that you have already heard about today. So the collective impact, the results-based accountability models, the evidence-based practices, best practices, and considering the voice of those with lived experience. And the complex social issues are being defined by conversations like this one that we're having today, based on the data that was sent to you in advance of this meeting. And this goal has kept us grounded in this work and in building with more community partners in order to find solutions to these complex social issues that we face. Next slide, please. Thank you. Data has always informed our work, and it really began to help shape our vision for 2030. As we heard from partners throughout the course of this year, 4 visions for a future in Buffalo County emerged. Building on the body of work that Travis shared on collective impact and data that was reviewed. And that data is also available on our partners website if you would like access to that later. Along with what we heard from you and about over 60 other partners throughout our board meetings this past year, we have drafted 4 key areas for vision statements to ground this work. And keep in mind, this draft is in no way final. It can be altered, added to, deleted, revised in any way by you and other community partners throughout this process. So for your consideration are the following. By 2030, our community will have resources that are easy to understand and accessible for all. We will have access to basic services for all residents. We will thrive when partners work together to coordinate services, and we'll value all people, and their voices will inform our work. Any thoughts or questions off the bat there? We're going to dig a little bit into these points and into each one, and a little bit of how we came up with these, how we defined those. So I'm going to kick it back to Denise to start out with our first vision statement.
Thank you, Nadia. So as Nadia shared, we looked at a lot of data. We had a lot of conversations, and many of you who are on the call today helped us really start to think about how to look at this work collectively. So when you look at the first statement, if we were all working together to ensure all resources in our community are easily understood and available for all, what would we need to know? And one of those pieces that we started with is starting to ask ourselves, what have we been doing that's done well in this area? And then what could we be doing better? What could be improved upon in the community? So we're going to go through all 4 of these vision statements with you, and feel free to take some notes. So we're going to be asking you some questions about what may be missing in the conversations that we're sharing with you. What did you hear from us? What maybe did we miss? We're also going to be asking you any surprises in the information that we've shared with you, or how maybe your organization can help spread this information, or who else needs to hear this, or how we can share this easily with others. So just a lot of questions. We're going to jump into breakout rooms here in the next 10 to 15 minutes when we get through these next 4 slides, so that we can have a conversation amongst all of you. So to start with, the resources are easily understood and available for all. So when we talk about what we've done really well, and I see so many faces on this call today, and I think I saw Chandra Diaz, her and Michelle Warren really helped us early on to launch MyLink, the MyLink app. We have known in our community for quite some time, we've heard this conversation over and over again, that there is no central location for resources in our community. It's hard for people to find resources. They're not sure where the resources are located. And during the pandemic, UNK stepped up and said, we want to bring forward MyLink It's available in multiple languages. It's an app that can live on your phone, whether you have a connection to Wi-Fi or not. It doesn't have any tracking, so it can be anonymously used. And with that, as a community, this is really important. Now, the one thing with MyLink is it's only as good as all of our partners working together to ensure that that information is available on MyLink. So UNK is committed to some additional time and hours to ensure that that information is getting uploaded onto MyLink. So some of those early wins with MyLink was conversations that were starting to occur around emergency housing. We started to ask, what are the needs of those who are looking for housing as they're coming into the police station, looking for somewhere to stay overnight or over the weekend? How do we ensure that we're serving more than just that one night stay, that one hotel room? And then we began to ask our questions, where are people going to find low income or affordable rent options? And a lot of those questions started to spur coordination amongst all of our helping agencies and housing agencies to say, where is this information located? If I am a resident in this community, how do I find those tenants? How do I find food pantries? How do I find where to go if I am homeless for an evening and I'm in crisis? So a lot of that coordination has been occurring, and it's just been fantastic work to watch. But I think when we begin to ask ourselves, how could we improve upon that? We begin to start asking all of you, and holy cow, having almost 100 people on this call asking this question, how can we improve our community in this way, is a great question for all of us to really reflect upon. And I think the one thing I want to just mention, and I think Kearney Works really brought it to an elevated stage for us. So Kearney Works' main goal is to get people jobs, right? And so they begin asking at these meetings, how do I help someone who's walking in our doors, that's working really hard to get a job, who does not have daycare, and trying to figure out what that childcare issue is and how to get affordable childcare, quality childcare for their children. And then also trying to understand what the mental health needs are. And Kearney Works says, mental health is not our area of expertise. Our expertise is in employment. So how do we begin to understand how to make these connections for individuals so that they don't have to shop for all these resources, but that we're really bringing and wrapping those resources around people who are coming in looking for jobs? And how do we ensure that they are sustained in those jobs and keep those jobs? And I think that goes back to what Travis was saying as a bigger picture. What are we all as organizations able to do if we're all looking through this lens of resources are easily understood and available for all? I think the pandemic, early days of the pandemic, many of you would remember that we saw some fairly large explosive areas coming out with COVID and the packing plants. And that really elevated the need for information in multiple languages. So that's something that we really are wanting to take a look at. We've heard for quite some time that when residents are in crisis, they're most often going to a friend or a trusted adult. And I think as organizations, we need to begin asking ourselves, if people are in crisis, how are they finding our information? How are those who are using our resources, how could they help inform better ways of sharing resources in our community? So just beginning to ask questions of where are our resources, how are we ensuring our resources are easily understood and available to all. I think last month when we first shared this information, some of the feedback that we received is that this needs to be across the lifespan, that this needs to be for those who are saging in our community, as well as those who are just being born in our community. So again, just thinking about what we've done well and what we can improve upon. Next slide, Matt. So the second vision element that we are sharing with you today for your consideration is access to basic services for all residents. So what we've seen working really well in the community is the start of the community response team. And I see many of those community response team members on the call today. So Nebraska Children and Families provided the community with some flexible spending. And they said that their primary goal was to prevent youth from entering the system and beginning to work as a community to work upstream to prevent youth from even entering the system, starting clear back to before birth, right? In the community, and really looking at the systems that we have in place. So a fairly large charge for the community response team. So that I would say is a big win for us. We've seen it working really well. We're beginning to start to see some of the ability of a system to track gaps and challenges in our community. We've been able to see the connections for people around immigration status, affordability of healthcare or mental health services. We've also been able to bring some technology. So when you look at those barriers to services, there's a lot of barriers in our community. So again, we begin to ask ourselves, if we were all looking at through a lens at access to basic services for all residents, how are we providing food, housing, healthcare, regardless of age, language, immigration status, cost, location, technology? I mean, you can keep reading through those pieces. What could we be working, what could be improved in our community is the next question we ask ourselves. And again, I think we come back to non-English speakers. Immigration status has been a challenge. I will tell you, listening around the table of community response team, the individuals who are placed in the center of those conversations who need some additional supports and were unable to find those supports in our community are around brain injuries, incarceration, and severe persistent mental illness. Those are some of the challenges that we continue to see as a community of being able to help individuals who are presenting with brain injuries, and how do we provide the support that they need in our community. So that's the lens we're looking at through access to basic services. If we are, as organizations and individuals in the community, are all looking through this as a shared agenda, how could we begin to make improvements in this area? So the next slide, I would hand off back to Nadia.
Thank you, Denise. Okay, our third example of a vision statement is families thrive when partners work together to coordinate services. So obviously the coordination of services is key to this conversation in all the areas that we're looking at. Some of the things that we have seen worked really well in our community is the development of early childhood childcare conversations and the support in the workforce development. Especially throughout the pandemic, we saw many examples of how childcare providers brought issues forward in the community. And when our partners heard of these issues, then solutions were discovered. For example, like pediatric size masks being available throughout the pandemic. So an example of an area where there is a desire to coordinate services, where we still have additional work that needs to be done, is last month at our meeting when Chief Waugh and Sheriff Miller joined us, and they both said that they have conversations about engaging youth every day, but they're not certain how to move that forward in our community. So how could youth voice inform this conversation? And what would their hopes be for a healthy relationship with law enforcement, businesses, schools, etc.? So as far as viewing this vision statement with the lens of youth and adults, coping skills around work around prevention, substance abuse prevention, and the connections of healthy youth and adult relationships. So think about, in your perspective, in the work that you do, what is missing from what we have shared? And we'll be having small groups a little bit later and have conversations about what are the specific things that we are missing as far as coordinating services to help families thrive. Our next vision statement is that has to do with end user voices. So we value all people and their voices will inform our work. This is a conversation that has been at the forefront from the very beginning? Are we hearing from those who are the end users? Are we hearing from those from rural communities? Sorry. Are we getting too much data or too much information from schools and from marginalized people? Do we have the voice of lived experience from parents in order to help shape the goals and the intentions of work in our community? One thing that has been working really well in our community, and again, has been highlighted throughout the pandemic, is Community Action's mobile food pantries in every Buffalo County community. There has been an extension and new capacities built in each rural community. We have seen churches, schools, and volunteers all setting up mobile food distributions. And we keep asking ourselves, how can we continue to build from that structure? That structure is working in our rural communities, but how can we build on that to have a greater impact on children, families, isolated adults? One thing that we have talked about is we have the capacity to have a greater impact if we're willing to take the time to build a trusted relationship with families and ask them, how can we help them in other ways? How can we help them gain employment? How can we help them find quality childcare? What are some of those issues that they are facing? What are those gaps and barriers that we may not be accounting for in that conversation? Brings us back to what Travis said at the beginning, and how childcare capacity was an issue, and bringing businesses together, bringing community members together with a shared agenda of increasing childcare capacity, helping residents to gain access to and retain employment. So I think the question that we're asking here is how could we build this community system that will track those real community gaps and ensure that needs are being met. Ensure those needs are being met by using the end user voice to inform that work. And this plays into all of our other goals. You know, resources are easy to access, and a trusting relationship is built when that lived experience really helps to inform our work. So that is our fourth goal. And sorry, I don't remember who I'm kicking it back to now. Is it back to you, Denise?
It's coming back to me, Nadia. Thank you. Behind the scenes, I prepped a couple people just in case this next question might be able to help us answer, and we are open to some feedback at this point. What did we miss? What surprised you most about what you've heard today, or what have we not thought about? And I sent a little message to Jason Owens, and I asked if he would just chime in here for a minute and let us know what he may be surprised about or what maybe we haven't thought about yet. So Jason?
Thanks, Denise. I don't think there was anything that really surprised me. Actually, I do. The surprise I had was how thorough this presentation was. I think you guys hit a lot of different things and found a lot of things that I wouldn't have thought of in all my work with Buffalo County Community Partners. So I was just impressed with all the things on there that I had never worked with or thought about that are a need in Kearney and Buffalo County.
Thank you so much, Jason. I also asked Dulce if she would chime in also and just let us know if there was any surprises she heard or just things that maybe we haven't thought about. So Dulce?
Hi. One of the surprises that I saw was the unawareness of just people and family in general, of not knowing where the resources came from. I've seen in situations where people get the help, but they don't necessarily know, who is the one behind the scenes contributing or funding the resources that they're getting. But I didn't think it was like like all through Buffalo County. I thought it was mostly in the populations that I was working with. And I feel that you cover mostly everything, but I would like to give you a little bit more from my perspective. For example, Buffalo County in general has a lot of resources compared to other areas that I've learned about, especially the smaller communities. However, I still see the resources not being provided in the language for for the minorities or for Spanish speaking. And more recently, we've had immigrants come from like Hawaii, Micronesia, like that they speak Chuukese, which I understand that it's a very difficult language to I guess to get the resources for. But I feel that for example, we have, I don't know, we have a homework clubs after school hours with I think they're great. However, for example, for the EL students or for the ones that are maybe no longer in EL, but they're still struggling with the language, and it's still, there's not much help with that. But the ones that are more fluent in English, I see how they're benefiting. For example, my sons, sometimes they stay in those clubs and they benefit greatly, but the ones that I serve, they don't benefit from it because of the language or sometimes the transportation. They don't, like, they won't have anybody to pick them up after school if they stay and don't take the bus. So that's one of the situations that I've seen. Like, and that's just one example. Yeah, there's so many resources for youth and many resources in general, but some of them don't, like the minorities can't take advantage of, if that makes sense.
That makes sense. Thank you, Dulce. I think you brought a lot of pieces to light for us to consider. And you even got a shout out from Abby Olson at CHI, agreeing with the many different dialects for us to consider, and how do we support those who are in our community and in the services and supports that they need. And I think an awareness too, I really appreciate your comment that it's not just those who are non-English speaking in our community who are maybe at times unable to find resources, but it's really across the entire community. And yeah, Chelsea Fusner with KPS is also jumping in around transportation. So thank you, Dulce. I have one other person I asked to jump in here, Angie Johnson. She's one of our childcare providers. And I don't know, Angie, if there's anything else you would like to share on what maybe surprised you or what maybe we haven't thought about.
I don't think anything from this meeting surprised me. What has surprised me is what Kearney has done for the community, or what COVID has done. It used to be childcare centers were here. The workforce was here. The food programs were here. COVID has brought us all together. So it's not just your business and your business and your business. We are all a community now.
Thank you, Angie. I know there was a lot of tough meetings that we went through during the pandemic to bring supports to childcare providers. So thank you for sharing that. I actually
had to close again as of today for 2 weeks because we have 2 staff with COVID.
I am so sorry to hear that, Angie. Well,
After
maybe we
the
can.
Emotions were out. We figured it out and we'll get through.
Well, you have 100 people on this call now that will figure out how we can help you. So thank you for sharing that. And if you need to talk offline, Tana and I are here to visit with you as well. Matt, would you like to jump to the next slide? All right. So will you, those of you who are on this call today, it looks like there's 97 of us that are on this call listening to this information and processing what we've been hearing. Would you be willing to join us on this journey? What might your role look like if you were to begin looking through this lens individually as well as through your organization in that lens? What other partners would you want to invite into a conversation about this? Is this information that we shared with you easy to share with others? Would you be willing to share that information with others? Are you able to point to a shared agenda that in the information that we've shared today, was that apparent in the conversations that we've been having? Are you able to coach and help educate other partners on collective impact? Are you willing to ask more questions to help drive impact? It's that, what are we helping people get jobs and retain jobs, or are we just putting on band-aids as we work through the systems and the services that we have available in our community? And how do we continue to be innovative? I've shared with the board 3 years ago when we knew we needed to look at the next 10 years through a different lens, a lens that we've never looked at in Buffalo County before. We've had great success since we started in 1996, but we knew going into 2030 that our lens needed to be innovative. When COVID come through, that really adjusted our lens, and we learned a lot through COVID. So a lot of the information we're sharing with you is really what we've learned through the pandemic, and hoping that this is a lens that we can all look through to really drive innovative change, because our problems have become so much more complex than what they have in the past. I've joked that we started with, and I think some of you prevention folk on this call, we started with don't do drugs. That was our very first initiatives with community partners. We moved on to, let's talk about what your brain looks like on drugs, right? So then we educate, we show, we tell not to do it. Then we bring in curriculum, great curriculum, evidence-based. What's the next 10 years going to look like for substance abuse prevention? And I think those are really good questions for us to begin asking ourselves as a community. What does that look like, and what lens do we need to be looking through to ensure people are getting their needs met in our community? So I'm going to pause there. I'm going to assume that you're all in this journey because I can see your faces. They're smiling. Feel free to give us a thumbs up. Feel free to drop something in the chat. Let us know if you're along this journey with us. Maybe there's something already on the slide that calls out to you and you want to just throw in the chat, I want to help with this. Feel free to do that. Our next slide, we are going to start breaking up into breakout groups, and we are going to start talking a little bit more about this in breakout groups. We have such a great response today. So our breakout rooms are going to be pretty tight, but we're going to give ourselves, are we still at about 25 minutes? Is that kind of what we're thinking in breakout groups? So Matt, if you'd like to go ahead and get our facilitators and get everybody into a breakout group, we can start with these questions. And the questions are also posted in the chat for you to start thinking about.
Yeah, all right, y'all. We have about 6 breakout rooms with roughly 15 or so people in each one. So it's going to be a little cozy in the breakout rooms, but I'll go ahead and open those up now, and then you can just join in, and I'll post when we have 10 minutes, 5 minutes left, just to give you you guys an idea of when we will be returning back. But I'm going to open those up now, and you should get a pop-up that says join room, and you can go ahead and do that. And they should be open now, and we'll see you back here in about 25.
God, I pushed the wrong button and kicked myself out of my room. Well, I was in the middle of a thought.
I'm sorry about that. Yeah, just hang with us, y'all. Everybody else hopefully is able to wrap up their thoughts and join us again.
Matt, do we have everybody back?
Yes, I believe we do.
Thank you. I always call you the maestro behind the scenes. You always get all of us in and out of breakout rooms so easily. So thank you for that. Let's go to the slide for us to type in the report back to the full group. And Maddie, are you facilitating this? Actually, let's lean on Joanna. Joanna, would you like to facilitate this for us? Oh, you're on mute. Joanna, you're on mute.
I'm still taking notes from my breakout group. We had such a great conversation that I'm like, oh, try to capture this to share back. So could we just go around? We have how many teams? 5, is that right? So what if I work backwards with team number 5 and maybe we could have each team, 6. Okay, this is going to be a little bit more challenging, but let's do this kind of quickly. Maybe each team could report back on one of the questions and we could just add to that. So rather than trying to get through all of the questions that you talked about in your team, let's just go to group number 6 and just start with the first question we had. Might be just any sort of what resonated for your team as they listened to their work, and who needs to hear this information. Could you just maybe let us hear your thoughts on that from group number 6? So who is our facilitator there?
Hi, Joanna, this is Martha. I
Martha.
had Deb go ahead and she will report out the conversation for group number 6.
Thank you. So just that first question maybe from your team, what resonated and who did you feel like needed to hear this?
Well, one of the comments was that we were surprised by the broad number of community members involved, and who needs to hear this? Professional groups need to be up to date on all of the information. At the end, someone even suggested that the mayor, the city council, the business community should be aware of what's going on, the collective impact model. I
think we got frozen there for Deb. But I like that, right? We had some of those similar conversations, like some of our public officials and community leaders. Somebody said sort of the city fathers and mothers need to hear this, and people who are planning for the community. So like the planners at the state, or excuse me, at the regional level and the city level could need to understand this as they're thinking about future possibilities in terms of funding and things that are working in the community as they envision the potential in the community. One of our team members suggested that on a kind of a yearly basis, you would need to present this again to the community because people shift positions and leave current roles in their leadership work. And so for it to be retained over time, you'd want to make sure that this is a conversation that happened periodically and it wasn't kind of a one and done in the next year, but that over time we come back and allow people to hear it again and again. And so, we had kind of a list we'll add to in terms of just sort of key organizations, many of whom have been part of this conversation, but just sort of thinking about who needs to be there. An interesting thought at the end of our conversation was funders need to hear this, because if we were going to move in this direction, it would change the tenor of our work. And so Lisa had shared that instead of a lot of organization helping people with little bits of their need, maybe one organization would help people the whole way. So instead of each organization contributing $200 or $50 to a family's needs, maybe one organization contributes $300. But what will happen is in the organizations will show fewer people served. And so how do we help funders to see that we're being more effective in how we're doing our work? It may change the data that we're collecting, and that would be okay. So I thought that was really interesting in terms of who needs to hear this. So let's go to the second question we had, and maybe go to group number 5. How did you see yourselves or your organizations taking part in this work? Who is our leader for group number 5?
Hi, Joanna. That was our group. And I believe Nikki Gossman is going to share.
So for that question of how we see ourselves on the work, we talked about how we need to just really evolve our current groups to do that collective impact and be more efficient, and really start thinking about how we can connect with each other and the other people that we need to connect with to do this work. And I'll just throw in, we also talked sort of in the same way that you were just mentioning, Joanna, about being able to figure out some sort of triage so that community partners is our clearinghouse, or they're the one that connects all of us and helps direct some of that information, but also having a way to make sure that we're connecting people in the right way and to help them get the answers that they need efficiently.
Great, thank you, Nikki. This is such an important question. Let me go to a second group also. How about team number 3? What did you say in terms of how do you see yourself or your organization in this work? Who's our lead for team number 3?
It was Travis, but he left us early.
Oh, Emma, it sounds like it's going to be you then.
It sounds like I got the short stick.
No, you got the great opportunity to share.
Oh,
what
the
was happening in your
opportunity.
team.
That's my favorite phrase.
Yeah, what did your team see in terms of how they saw themselves or their organizations in the work?
I mean, I think that overall, everybody is on the front lines and doing the work with our agencies every day. So we all kind of felt a deep connection to the work, connecting clients to care, serving in the communities that we're all in. So I think that we would just echo kind of what everybody has already said. We talked about kind of the work groups that already exist within the collaboratives, and how well those are going currently.
Nice, good. I'm just trying to go back through my notes for team 4 in terms of how they saw it. What was, I think, interesting in our team was that people saw the work that they're currently doing is sort of laddering up to this work. And so Two Rivers, for example, is working on an advisory committee for minority health, and they're doing focus groups in the community. So some thinking internally about how these goals align to that. And so they're already thinking about access and the voices of those who are being served. And so how those two things kind of pair in there. Beth offered that at UNMKC, she's doing work on assessments and helping teams to sort of evaluate and look at their work, and would be able to provide that skill personally to Buffalo County partners as somebody who could kind of come in and help think about how do we assess the things that are currently working internally and then make some adjustments. So I think that there was a lot of conversation about people are thinking about just what are they currently doing that already is addressing these goals, and how do they share that work more broadly in the community that they are already aligned, right, to some of this work. And I think that was really helpful. Let me go to the next question then, what would be helpful as we present this information? How do we make this really easy to understand for people who are not in this conversation today? And let me get some reflections on that. First of all, from team number 2, who was team number 2's lead?
That would be me.
Okay, Nadia.
So I think that our group talked about the fact that sometimes the people who really need to be most aware of this work are those frontline workers. So in our situation, we had several people from KPS, so it's the teachers. Unfortunately, those service providers are the ones who have the least time to sit in on meetings like this and have these conversations about bigger pictures and coordinations between services. So a lot of times that information just doesn't trickle down, or they don't have the time to fully understand or pass that information along. So we did talk a lot about individuals or services having a better understanding of the programs that are available. I think that the conversations between services with that provide similar things have been very important and will continue to be important moving forward. Really being intentional about the coordination of those services and sharing that information. was something key that we talked about. And then the other thing is just that burnout effect that everybody feels, do I have to know everything about everything and be able to connect everyone to all possible scenarios? And so that's the conversation that we had was, we're not necessarily asking people to do more, but we're asking how can we collectively do better?
Yeah, nice. Very nice, Nadia. Thank you. Let me ask that same question of team number one. What did you discuss in terms of how this could be accessible? And is it an easier ways to make this, share this information out in the community? What did team number one add to what Nadia has already shared?
Thank you, Joanna. I think most of you have mentioned a lot of the conversations we have, and I love your example of that laddering up, Joanna, because I heard Gabe Kowalik with law enforcement talk about some of the work they're already doing and how there was an ease in being able to present this information and continuing to like ladder up, like you're mentioning, to a larger picture. And one of the things he talked about is just that need to educate or the need for resources to help officers as they're going into those situations, being able to share those resources with families. And that seemed to be a really strong theme through everything we were talking about. I asked Dulce again, you know me, I always ask if you wave your magic wand, what would you do differently? And Dulce was all about how to engage the parents of the children that she's serving. And it just seemed to be a constant theme in the conversations we're having, right along with the Hanny Aram Center and Jason Owens talking a little bit about that as well, that they're serving individuals where the parents are present and just having those resources available in easy to understandable formats would be great. I think everyone, just about unanimous. We had such a packed group, it was hard to get around to everyone, but I think everyone come back with saying the information is very easy to share. They're very willing to share. They were thinking of people that they could share with. I don't know anything else I've missed. I think the rest of the stuff I put into the chat.
Great. That's a good list. And we'll keep track of the chat as well. I would just add from team 4, our team got really concrete on this one. And we said that at the front end of a presentation, it would help for the community members who are not in this conversation so far to realize how many people have been engaged in the conversation. You know, hundreds of people have been hearing this and thinking about this. And if you think about the evolution of the work from Vision 2020 to 2030, you know, that whole scope of people that have been involved, so that as we make the presentation, it's really clear that this isn't just coming out of 10 people sitting in a room. This is coming out of hundreds or dozens of people that have been thinking about this work together. We also talked about, though, that while we like this philosophical sort of background to why we're doing this and thinking about this, if you're a person who's got 20 minutes to 30 minutes to hear this presentation, you might be really interested on how does it translate to action, right? So because of this, we're now thinking about these things being different and how we begin to track over time within the community the changes in work in organizations based on this understanding of these 4 focus areas. And so it'll become even more compelling over time if we're able to share more of the results of what's happened as what's come out of this conversation. And so tracking those results and the changes in the community is going to be important as we keep going forward and thinking about there'll be new people constantly coming into the dialogue. And so how do we make it quick and efficient on the one hand, but also give a little bit of the flavor of the depth of the work that's gone into coming up with these pieces, and then to be able to reflect the results. People like to see action, is what someone said. So I think that would be important, and that there might be ways for us to consider inviting organizations to share back what they've learned over time and how that can be put into some good examples. Let me move to our last question, just as I look at time here a little bit and be thinking about that tough question about how do we continue to engage in and meet to talk about this work. And let me just kick off again from team 4. We talked a little bit about people may want to hear more about the deliverables over time. People may want some very clear sort of resources that if you have this problem, here's where you go to get it met. And so that we might be able to provide some support to organizations that may only be able to do a piece of the puzzle, but they could see the entire picture of where the community resources were. And then we talked a lot about the value, and this came out in our very first question, but really the value of having the people who have immediate experience, lived experience with this work. How do we invite them to the table and make sure that we learn from one another when we've been successful at doing that as the work evolves, and be conscious of where we're yet not getting there. We loved the idea that that was written into the goals as something very specific. But we need to learn from one another about how we've gone about making sure that the people who have lived experience really are able to have their voices in the work, and that we're able to really demonstrate that we've listened to those voices and addressed the needs and the concerns that were shared with us. And then I think we circled that we ended that conversation with just this could change how we work, and those who fund our work will need to understand the differences in our work. Let me circle back in terms of how we might continue this conversation to our first group, Team 6. Did you have any additional thoughts on how we could continue to meet to do this work going forward? Deb?
It's hard for me to answer that question. I've had a serious network problem since I last spoke.
Okay.
I missed a bunch of the talk, so I have to pass.
We'll let
I'm
you
sorry.
pause for right now because of technology, Deb. Thanks. Let me come back. Let me go back. Anyone else? Emily, did your team talk a little bit about how we can continue in the work?
We talked about like maybe a monthly cadence just to check in, see how things are going. We talked about maybe having work groups, kind of how the collaborative does now, if we needed to have some different work groups, and then maybe go to quarterly just to check in and see how things are going.
Great. Thank you, Emily. Nikki, what about your team? Did you talk about going forward?
We didn't really get to that, but I think all of these things we discussed, and then maybe just to add to that, making sure that when we are seeking information and we're giving information, that it is clear and concise.
Great, thank you. Nadia, what about your team?
I would say that in that realm, we talked about better communication. And there was some conversation specifically about MyLink and making people aware at all levels of MyLink, possibly updating on their end, you know, whatever they have posted in there for MyLink. So just as a tool, making people better aware of those tools, and the ability for them to share those with families or kids.
Great, thanks, Nadia. Denise, what about you?
Deb,
you had a thought?
Let me inject something about MyLink as I see it typed there as MyLink, when it's actually MYLLNK. And I asked about that, and someone said, well, you know, LNK represents Lincoln. Well, as a retired University of Nebraska person, I know that. And you know what? I don't care. When I also, as a retired IT person, I just think, well, MYLNK means that someone else was using MYLINK. And it's just really important that we tell people how that's correctly spelled so that they can find it. Otherwise, they try MyLink and they go, well, that doesn't work.
Thanks,
now
Jen.
I don't, you know, now I don't know what to do. So we have to make sure that we advertise that with the correct spelling. Okay,
Great.
I'm done. Thank you.
Thank you. That's good. Who is I going to? Denise.
Yeah, I think you were coming to group one. I think if I could paraphrase a little bit of what I heard, and I don't know that we got a chance to spend a lot of time in this space. What I heard was that people were very willing to go back into the organizations, talk about this work within the organizations or with others, like other boards that they might be on, to have that conversation. And if there was some way to have a dashboard or something that people could connect with that was easy to understand, they could see themselves in that dashboard and the work that's occurring, was really important. And I don't want to forget another piece that I didn't mention last time when I was talking Joanna, was Karma's comment that she was representing Shelton and just figuring out a way to bridge that, those rural communities. And I like the piece that I think another group was talking about, and I'm not sure if I can use the right language, but that cadence where people seeking and connecting information is easily flowed through those conversations, and those rural communities are asking for that, and that come out real clear in our conversations.
Yeah, when we think about voices that are not being heard, right? How do we make sure that our rural partners are getting their voices heard in this? Very good. That's helpful.
One of the issues noted in group 6 was transportation, the need for transportation for people who want to work and don't have transportation, or transportation to school. And yesterday I was driving on Highway 30, and I was just east of Gibbon, and I actually saw a ride vehicle turning onto the highway. East of Gibbon. So, and I didn't know that they provided a service outside of Kearney. So I guess that's something I need to follow up on.
Cool. So I know what we're going to ask is that each group submit notes back in. What I didn't ask my team is, where do those go to? Denise, is that our facilitators will make sure that we've captured your good thoughts, and we'll get those notes back in. That's why I was typing furiously. So if we didn't get reports out on each question from each team, know that we will gather that feedback. And that's what we're going to be thinking about, is sort of what's the right timing to call people together and to report out successes. So I think we would just invite you in each of your organizations. This is really accessible. We'll be happy to make the presentation available. We'll be happy to think about how we can bring the presentation to you, but we are eager to hear the alignment that your organizations have with this work, and eager to think through with each of you how we can continue to build on the work that you're currently doing as we move through this conversation. So it's not, as we've, fear one and done. This is the beginning of a conversation that will continue into the future and continue to evolve as we think about how we continue to collaborate and move to more of that collective impact model in our community around these large community goals. So Denise, other thoughts, or should I turn it back to you and Nadia?
I don't know that I can make complete thoughts right now. My head is just kind of buzzing a little bit. So I am just so thankful for everyone who spent this hour and a half with us. Wow, what an amazing group. Who would have thought that we could have such an effective meeting in an hour and a half on Zoom? But the pandemic has taught us that we can do that. So thank you. I also see Peyton Tracy there. Thank you for jumping in with us, Peyton. I don't know if we had any other youth, but thank you for Pleasanton High School helping us get kiddos represented on our conversations today. We will process. I don't know if Nadia has any other thoughts, but we're just going to sit here and process for a little bit, and then we will be back in touch and open to any other thoughts people have. If you wake up tomorrow morning with an innovative idea, please reach out to us.
Terrific. So you see there, as we close, Denise's contact information, the email, and we'll be looking forward to getting your feedback on what your thoughts are today. And we do believe, from our experience so far, this is a conversation that resonates, and it's one of those later at night when you're not so busy, your brain will perhaps come back to you and be able to share some more thoughts with us. Okay. Do we have anything more at Denise or Nadia in terms of wrapping up?
I just want to say thank you to everybody who took time out of their day to join this conversation.
Yeah, we really appreciate it. We look forward to continuing the dialogue with everyone. Okay, so with that, I think we'll release you to the rest of your day, and we'll look forward to continuing to talk with you and sharing more about this good work. Thanks, everyone.
Is anybody else's head just swimming a little bit, or is it just mine?
I know mine is. So my ability